of our talk show series, Guide to Good Gut Health, brought to you by IHW Council and powered by JB Chemicals and Pharmaceuticals. I'm your host, Dr. Yashodhara Sharma, and today we are here to explore a crucial topic many parents encounter but often find challenging to discuss. How can you tolerate in a child who's dealing with constipation? To throw light on this issue and provide practical advice, we are joined today by Dr. Tushar Shah. Dr. Shah is the Director of the Department of Clinical Research at KG Patel Children's Hospital and serves as the Chief Consultant in Navakar Children's Hospital. He brings in a wealth of experience and insight to our discussion today. So without further ado, let's dive into this important conversation and welcome Dr. Shah together. Dr. Shah, welcome to the show. It's a pleasure to have you here with us today.
Thank you very much. Thank you, Ms. Sharma. And it's a pleasure to be on this important platform where we can discuss a very, very vital topic, which you rightly say. Thank you.
Dr. Shah, before we dive into the specifics of toilet training, let's first address why constipation in kids is a major concern for parents. And what are some of the challenges and implications of this issue?
Right. So I believe that constipation is not as often complained by the parents or not perceived as a main complaint by the parents as compared to diarrhea or fever or so many other symptoms. So many times in our practical real life situation, we have realized that most of the parents, when they go out of the consulting room, it's just a passing remark that child has not passed stool since last so many days, or there is some difficulty in passing stool or passing hard stools, or there is pain while passing stool or something like that, which is an offhand complaint. So many parents underestimate the issue, but then they are really having a lot of burden because of that, or a lot of anxiety or a lot of issues at home with that particular challenge of not able to pass right kind of stool by the child at a right kind of age. So it's an important issue, definitely, and we need to address. We know that iska pet barabar, uska pura sharir barabar. So if your tummy is not getting cleared at the right time every day, the way you want it, there are going to be a host of diseases which the child may encounter, and therefore we definitely would want that there should be a happy, healthy bowel habit in each and every child. It can lead to various problems like say piles, or say low self-esteem, or they're not very comfortable, they're not otherwise able to focus on their education in schools because they're not passed stool in the morning. So there are a lot of issues in medically also, socially also, psychologically also, and to the family also, the agony and the pain that they perceive. So I think they should be addressed in a big way.
Thank you, sir, for candidly telling us that parents don't often, openly talk about it. This definitely raises awareness among our viewers, and especially the parents who are watching this. Sir, it would be also great if you could help our viewers understand that how constipation is in children, and what are the causes of it? What is the etiology of the constipation?
Yeah. So if we look at constipation per se that we get in our routine office practice, the 95% of cases of this constipation are usually functional. So what we mean by functional is that there is no organic underlying cause. So whenever there is an organic underlying cause, like there is some structural deformity of the anal opening, or there is some neurological disease, or there is some thyroid issue like hypothyroidism, which can happen in young children and they can present as constipation. There can be some neurological problem where there is aganglionic megacolon. So all these are the disease situations which require actual medical treatment, maybe investigations, and this can be picked up by the red flag signs, which we may discuss later if you want. But more often than not, 95% of constipation is not this. It is functional. What we mean by functional is that there is no underlying cause. The cause is habitual, behavioral, or some anxiety, or some stress, or some new school change, or some recent stress, dietary habits. All this can lead to a vicious cycle where they don't routinely pass stool normally every day, and then they go into a vicious cycle where the stool becomes dry and there is distension, and then there is atony, and the peristalsis, normal movement of the intestine, is lost, and ultimately they have those withholding postures where they don't want to actually pass. They are not trying to pressure and pass, but they are trying to withhold because they know that while passing there's going to be a hard stool which is going to come out and going to cause some pain. So this pain and not able to pass, again more pain and not able to pass. This vicious cycle would lead to a chronic long-term constipation, and which can be tackled in a nice way, which we'll discuss soon.
Thank you. Thank you, sir, for the information. And sir, in your practice, how common it has become the issue of constipation among children?
So in a general pediatric OPD, which I am a pediatrician, it would be around say 3 to 5% of your patients. So out of 100 patients that I see, 3 or 5 patients will be of constipation and need definite some treatment. Whereas a pediatric gastroenterologist, who is a specialist for GI problems, would see almost 33%. So 1 in 3 patient is a constipation case. So it depends on where you are treating and who you are. So it's a big problem. And if you look at the whole population, the problem is massive.
Thank you, sir. Thank you for raising this flag up high and telling the viewers that they should be aware that this problem exists and should be spoken about. So we would also like to understand and especially enlighten our audience with this information, that how should they identify whether the child is constipated and how they should manage it.
Right. So what we mean by constipation is that many people think कि 1-2 दिन नहीं किया तो क्या फर्क पड़ता है, ये तो रोज alternate day करता है, पहले से इसका habit यही है. So there are a lot of myths and misconceptions about the bowel movement. So one must understand that a normal newborn baby, it may not be necessary that the child passes every day stool once, who is on exclusive breastfeeding. So usually a breastfed child may pass 6-7 times a day also, which is normal, to once in 6-7 days also, which is quite normal, because whenever they pass the stool, it is usually soft without any straining, and there is no hardness or there is no pain or nothing like that. But whereas in a slightly elder child who is above that newborn age, if you see that child has a lot of difficulty in passing stool, not able to pass daily, there is pain while passing stool, there is bleeding while passing stool, there is strain a lot while passing stool. Even a toddler or a preschooler, when they have a situation where they're trying to withhold, or there is soiling, or the overflow incontinence is there, or whenever they check the undergarments, they are usually soiled with stool, a small quantity, hard stool, which is lying there, because child is trying to hold and small quantity is getting passed, because the child feels a lot of pain and therefore child doesn't want to pass stool. So these are the typical things which we actually get when we discuss constipation with the parents.
Thank you, sir, for these are very important points. And now from this insights which you are bringing on table, I think we should move to the heart of a discussion, which is what are the effective techniques of toilet training for kids, and at what age should parents start the process?
Right. So when we say that this functional constipation, one of the common reason is inappropriate toilet training, which can also lead to the functional constipation, which is one of the commonest reason. Many hyper parents believe that I should potty train my child very early in the life. So they start doing it at 1 year or 1.5 year or 2 year also. So the right way of understanding this whole procedure is to that no potty training or no toilet training should be attempted before 2 years of age. So it is usually after 2 years of age, usually between 3 to 4 years of age is an ideal age when we expect the child to be potty trained or toilet trained. So the potty training or toilet training should be attempted between 3 to 4 years of age. That is one point. Second is that when we say toilet training or potty training, what we mean by that or how do we do it? So there is a typical rule which is said as rule of 1. So a one person means the same person is doing it every day with the child, same place. So one place. So you don't keep changing the toilets or the location, because then child gets that habit. If you make them sit on a potty table, then it's fine. You make it seem on an Indian toilet or a Western toilet, but the same place. Then you use by the same person, usually after meals. So like same time you would say, but 3 to 4 times a day, you should make him sit on the toilet or commode or potty tables or whichever place you are doing it for 5 to 10 minutes after within 30 minutes of a major meal. So that's a good time when they have a gastrocolic reflex. So this gastrocolic reflex helps for gastric emptying. And so that's a very wonderful way to initiate the process. And the last important point of this rule of 1 is the same word which you should use. Somebody saying poo, somebody saying potty, somebody saying chichi, somebody. So whichever word you're using to explain it to the child should be the same word that you use it every day. So there is no confusion in the mind of child that what is supposed to do. So all these small things, though may look very and less important are very, very important. So the same person at the same place, same time, and the same word. This is known as the rule of one, which we need to use when we are trying to train for the potty. One must understand that the position in the toilet is also very, very important when you are trying to do toilet training. So now this Western toilets, the issue is that usually the legs are hanging in a younger child, and with that the angle that is achieved at the hip level is not the right kind of angle. So the old traditional Indian toilets had a very good angle which would help to evacuate the bowel very easily. So now in this situation, when all of us are used to this Western toilets, what is important is that the leg should not be hanging in this child, and you should give some footrest. So a proper footrest where the knee joint goes above the level of the thighs would help, even if we are on a Western toilet, to make sure that there is a proper angle so that it helps for bowel evacuation, and that there is a proper angle which will help to align the structures in such a way that the stool gets evacuated from the rectum. This is also very, very important. And over and above this, diet and other things are there which we can discuss later.
Yeah, thank you. Thank you, sir. Thank you so much for all the information which you have given, and especially the rule of one. Great advice. So we also wanted to understand what precautions or measures should parents follow, especially for school-going toddlers, to ensure that their child doesn't face constipation-related issues while at school.
Right. So it is very, very important to make sure that before the child goes to school, child should pass the stool. So that's what I tell all my parents, that you have to ensure. So the biggest challenge nowadays of these preschoolers or schoolers is that we all have a habit of sleeping late. And of course, the kids are going to follow the parents as their role models. So they also sleep late. So a child who has slept very late, it's very difficult for us to make sure that the child gets up early enough to make sure that he has enough time in the toilet. So there is no adequate time. There is a van which is coming, or they has to be dropped to the school bus. And because of that time management issues, early morning, most of the time parents only have to insist that forget stool and other things, get ready, get your things in and go to the school. So we have to basically try and postpone passing of stool after they come from the school. So many of the kids I've observed, they have habit of not passing stool in the morning, and they want to pass afternoon or later on when they come home, which is actually not good, because their concentration is going to be hampered, their education is going to get hampered, they're not going to learn well, plus they have a lot of stool or toilet sensation when they are in the school, but they don't like the situation there. They don't like the toilets there in the school. They will be dirty, they will not be cleaned as well as the house ones. So they try to avoid there also. So when they have a sensation, they are trying to hold on to it. And when at home, they have to pass because the whole secretions have dried up. So this hard stool become difficult to pass at home. And therefore, they go into a vicious cycle where they end up into constipation. So my advice to parents that we should sleep early. We should make the child sleep early. They should get adequate sleep. They should get up early enough to make sure that they have adequate time, and we have adequate time to supervise them when they are in the potty or in the toilet. And we ensure that they have done complete evacuation. They have done proper stool passing before they go to school. And also important that they take good breakfast so that their concentration and other things are going to be good. Right.
Thank you, sir. Thank you so much for the information and wonderful insights. Speaking about preventive measures itself, what is the role of diet in managing and lifestyle in managing constipation in children, sir?
Right. So one of the cause of functional constipation, again, as was toilet training, is a diet. So many of us, and we know that a lot of these kids also love eating junk foods and all white flour things. So maida is the biggest challenge. And another biggest challenge is the milk. So many of us believe that milk is a staple for a child, and milk is very, very essential. Many of us are so much overdoing about milk that we end up giving liter of a milk and we still not satisfied that child is getting adequate milk. So two things which I would like to say here as far as constipation is concerned is that we should avoid milk, or we should be very, very much low on milk. So especially all those kids who have constipation, they should definitely avoid milk for a long time till that constipation problem settles. But even to prevent constipation, we should be not taking, or we should not be advising more than 100 to 200 ml of milk. That is enough. So liter of a milk or 500 ml of milk is not what is ideally recommended or required. And we can look at other sources of calcium and other things like eating banana or a few other vegetables and other things, which is going to be good in fiber and which is also going to add to roughage, calories and other things. So low milk and low maida or no maida. So when we say maida, we know that all these junk foods, breads and pastries and cakes and Maggi and pizzas and pastas and all those things are going to add to the problem of constipation in a big way. So roughage and fiber has to increase, and that can be done by adding vegetables, fruits, and plenty of fluids again to add to softness of the stool. So plenty of fluids, no maida, more vegetables, more fruits, and low milk or no milk is a good diet, which I would recommend, especially for those kids who want to prevent or who have constipation.
Thank you, Dr. Shah. This is wonderful information for the viewers. In line with the same lifestyle management, are there any specific exercises or activities that you would recommend for children dealing with constipation?
So definitely it helps for constipation, but in general, because of the sedentary lifestyle, most of the time they're sitting, watching TV or doing video games or on any sort of screen they are. So decreasing the screen time and increasing the activity in any form, outdoors or indoors or dancing or music or whatever they can do is going to definitely help to increase the motility of the bowel. So by doing activity and avoiding sedentary lifestyle, it helps in so many ways, including helping for handling constipation and staying healthy and happy.
Sure, sir. Thank you so much. And for parents, sir, do you have any suggestion they can create a supportive or a stress-free environment at home, which will help them to, aid their child and especially the one who's constipated for toilet training? Any such advice? Yeah.
So when we are dealing with the patient of constipation, other than the medical therapy or the medicines that we prescribe, more important is to maintain a stool diary. So we also give parents something to take home, which is a stool diary, and where we want them to note down that how many times the child is passing stool, whether the child is passing in the morning, whether there is any pain associated while passing stool, the child has passed properly or not, the child has taken medicines or not, what type of stool. So there is a Bristol chart which they can refer to, which is there in the diary, where they would know that which type of stool the child is passing, because many times there are language barriers and it's difficult to understand what the parent is saying or what the doctor is imagining. So when you pinpoint a diagram and show them that this is the type of stool that we expect normally, this is the type of stool which a child is passing, which is not right. So though this topic is not very easy to discuss with them, but when you make them understand on a diagram, they understand that yes, this is the problem and this type of stool child is passing, and we expect child to pass this type of stool. So this is one thing. Second, when you start treatment, over and above toilet training, over and above diet advice, the other two things which are important is to have compliance, because the drug therapy or the medical therapy is going to be for very long, in maybe 3 to 6 months. So for that to be ensured, we need to have this stool diary and we need to be counseling properly, so that whenever child passes normally, they stop the medicine. When they stop, again the child is going to go back to constipation. So the treatment of constipation usually lasts for 3 to 6 months and it's gradually tapered. Another thing which you rightly said about handling the environment in the house, which I would put it as a positive behavioral modification therapy. So when we try to change the behavior of the parents and change the behavior of the child to a situation. So motivating the child and motivating the parents to take it seriously and to take it in a positive way, rather than doing punishments for not passing. You appreciate for, or you give some reward or some star or something whenever child passes stool properly. So this is going to maybe motivate him to do it on own. Plus, because of the pain and because of other things, the child is trying to retain and not able to sit. Most of the time, these kids are passing stool in standing position or in the diapers. They're not ready to even sit on a potty or commode, because they know that when they sit there, there's going to be some pain. So you need to alleviate the anxiety. You need to train them how to take care of this pain, maybe some therapy also for that. But over and above that, a lot of motivation is required of the parents, of the child, to make sure that the child passes stool. This is all very important.
Thank you so much, sir. Sir, can you also help us understand the health and psychological aspects of constipation in children, especially regarding if they're not passing the stool in a timely fashion, like you just discussed here?
True. So definitely a child of constipation would have some or the other low esteem issues, they are not comfortable, they're not able to focus in the school, the concentration is disturbed, their attention span is going down, and their studies and academics also may suffer if it is chronic and long-standing. Definitely a child who is not able to pass stool properly at home and goes to school and has a chronic constipation and is passing small stools in the undergarments, that foul smelling and that bad smelling would make him in a position where he will have less friends, or people go away from him, stay away from him. So all this leads to a lot of psychological issues and peer issues and not comfortable situation in the school. And all this in turn will lead to issues in the parents, where they try to handle this, but they're not able to do it. So a lot of rift between the parents, a lot of rift between the child and the parent, between both the parents also struggling and quarreling because of this issue. So that many times we have seen this happening in our office practice also. So though this problem looks a very small and trivial, I would say that it's a big problem which needs to be taken up in a very big way and managed in a big way with the right kind of medicine, right kind of approach, with a lot of behavioral modification therapy and some counseling which is required of the parents and the child both. And of course, definitely toilet training and diet training.
Sure, sir. Thank you so much. So for parents who have already tried various methods like toilet training and behavioral changes and giving a positive affirmation environment at home, what would be your advice that when they should consider seeking professional help? Like, what is the point?
So any constipation which is like, say, almost chronic, when I say chronic, it is like about a month time. So my child is not able to pass or passing less than 3 stools per week for more than 4 weeks. There is some pain, or there is difficulty in passing stool, or there is a strain lot while passing stool, or there is occasionally blood or something coming in the stool because of the fissures that may have developed. So in that situation, they should definitely consult their family physician or a pediatrician, who will definitely guide them about not only medicines but about other things also which needs to be taken care of. So many times people are not aware about all these things and they just keep doing routine home care. They use home-based things. They use all those fakis and other things, or castor oil and other things, which actually may be detrimental and cause more problems than helping the child. So a professional advice, I would say, any day is better in a situation like this, because it becomes chronic. And then by the time we take help, it takes a lot of time to recover out of it. So if I take a timely advice, it's going to help to cure and control it earlier and a better way.
All right, sir. Thank you so much, sir. So could you also share some tips with the parents that how they should talk to their children about constipation and toilet habits without causing embarrassment and anxiety? Because this is a key issue which revolves around the sensitive topic.
So like when it comes to talking about toilet or about passing stool, I think it's all about not only this issue, but every issue. So there are a lot of rifts which happen between parents and kids, especially preschooler. It is not very difficult. Of course, you need to get more involved and give a lot of time. But when it comes to a toddler or an adolescent, it becomes even more challenging. So better is that we solve this problem as early as possible. By the time they go into a school age or an adolescent age, it becomes there are a lot of other issues also which comes when you are discussing all these sensitive issues. So definitely that channel of communication, this remains or needs to be open between the parents and the kid. There are supposed to be good times when you discuss all these things, and there are supposed to be times when you are at ease and you take opportunity and take up this issue. A younger child, it may not be difficult because you just need to ensure that child sleeps at the right time, gets up at the right time, has adequate time in the morning before the school bus or the van comes, and you make sure that child is made to sit in the commode or potty for about at least 20-30 minutes, and you make sure that child is passing completely. Maybe you will have to actually supervise and see the child has passed, because many times we just send them to you go in the toilet and come out and he said done, but you don't really know what has actually happened. So whether child has really passed or not, whether it is complete evacuation or only just some amount of stool is passed and a lot of things is still remaining inside, and then the child becomes uncomfortable in the school. So you need to really ensure things, and you need to be really sure when you say that your child has passed the stool in the morning. For a slightly elder child, of course, you need to make him understand that what we are doing and why we are doing, and why it's an important habit and why it's a good habit to pass stool. So he will understand, because you have to talk age appropriate commands and age appropriate understanding depending on the age of the child, of course. But then at every place, parents needs to be involved, and it is not just the mother, but mother and father both. So many times we think that this is just the responsibility of the female member in the house, but it's not so. Both the parents need to take turns and maybe help, and maybe need to really see to it, because otherwise it becomes very difficult, and then again this problem cannot be managed so well. So we should be taking it seriously and doing it properly at any age that we deal with.
That's very, very important point and relevant, that both parents should be involved, sir. And would you also say that there should be collaboration from teachers or caregivers also in managing a child's constipation, especially for the school going?
True. So what happens, especially in these preschoolers or nursery kids or lower KG, senior KG, they are not so well toilet trained, and we don't expect them to be. So many times the challenge in the school is that the environment there or the toilets there are not that clean, or the IMRC who is helping also may not be wanting to help in a proper way, because teachers won't know, nobody's supervising them. So if they are doing their job in a right sense or right spirit, and if they are really helping and toilets are kept clean, then it may not be difficult even to manage it there. But most of the times, even in all those hi-fi schools or good schools, also this problem is there, where toilets are not so clean, child doesn't want to go there. The ayahs or the person who is kept there for handling this issue is also not very sincere about it, and they also want to finish it off fast, so they don't do their job properly. So if we take care of this issue, then maybe even in school level also child would be able to pass it properly.
Makes sense, sir. Definitely. Finally, Dr. Shah, what are some resources or tools you would recommend for parents seeking more information or support regarding this issue?
So a lot of internet videos and PPTs and information definitely is available, but as I told you, it's very difficult to filter out which is the right kind of information and a myth or a wrong information which is also being promoted, because there is no filter or no clear definition of deciding which one is the right information. So I would tell you that the best way to go about when you are held up or when somebody has a problem of constipation is to take a professional help from your medical professional. And all those home therapies, I would say, are not good, especially using those fakis and those castor oil and other things. Actually, it leads to more habitual problems, and just using rescue medicine as and when occasionally for a few days and stopping becomes even more chronic, and to come out of that becomes a very long-standing process and more painful process, I would say. So before child has fissure, before child starts developing piles, before there is blood in stool, before it becomes a very chronic and a low self-esteem problem, or it becomes a psychological or psychiatric problem, we should take professional help, and we should take help of your family pediatrician or a family physician, who will definitely guide you not only on this behavioral aspects, but there are some medicines which we need to take in the right kind of way. So usually initial 3-4 days, there is a disimpaction treatment, and then there is a maintenance treatment, which is to be done for 2 to 3 months. And then it is tapered over a month or two, because you don't want the problem to come back again. At times when the problem is not solved, or when you see after a few days of starting treatment, child is not recovering, or child is still having a constipation, then I told you we need to look at those organic causes, which may require some investigation, some X-ray, some sonography, some blood test, and may require some specific treatment for the underlying cause which has been established. Very, very rarely we need to take help of a subspecialty like a pediatric gastroenterologist, where there are some specific problems which may require even higher investigations. But all these things are rare things. The common thing first, which is a behavioral problem, which is a functional constipation, which is can be handled by routine office practice with some medicine, which has to be taken a bit longer.
Thank you, Dr. Shah, for this enlightening conversation. So much information for our viewers, and this topic is very sensitive and people often skip to discuss it, and you have shared wonderful practical advices. To our viewers, we hope this episode helped you better understand and manage your child's gut health. Please remember, addressing constipation is not just about physical well-being, but it is ensuring the overall happiness and comfort of your child. Do join us next time as we continue to explore vital topics on health and well-being. Don't forget to follow us on social media for more health updates and resources. Please stay healthy. Take care until our next meeting. Thank you so much. Thank you, Dr. Shah, for this wonderful interaction.
Thank you. Thank you very much.